What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for February 26, 2021. The pandemic baby bust, the disruption of COVID-19. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Public Health on Call's first episode was released on March 3rd, 2020, when there were 1,922 documented cases of COVID-19 around the world, with just 21 known cases in the United States. 1 year later, more than 28 million people have tested positive in the U.S. The pandemic has killed nearly 500,000 Americans and more than 2.4 million people around the world. In over 260 episodes, we've brought evidence and experts to help unpack the day's COVID-19 and other public health news. This podcast has been downloaded over 4 million times in the last year, thanks to listeners like you. In recognition of the 1-year anniversary of the podcast, Public Health on Call is going live. In addition to our regular episodes, you can join us for a live episode at 11 a.m. every morning, starting Monday, March 1st through Friday, March 5th on the Johns Hopkins Bloomberg School of Public Health's Facebook page. We'll be talking to national leaders and experts on COVID vaccines, health equity, and mental health, and hearing from a top public health official about the state of the battle against the pandemic. We'll also be taking your questions from the comments for a special finale Q&A on Friday, March 5th. You can learn more about the full lineup at Johns Hopkins SPH on Facebook, and be sure to tune in live for the first session on Monday, March 1st at 11 a.m. Today, Stephanie Desmond talks to Dr. Philip Cohen, a sociologist at the University of Maryland, about the long-term demographic impacts of COVID-19 and the incredible disruption it has caused in so many lives. They talk babies, marriages, divorces, and more. Let's listen.
Philip Cohen, thanks so much for joining me.
Hi, thanks for having me.
So today I want to talk to you about sort of the sociological effects of COVID-19 that we're seeing now and that you expect us to see going forward. And I wanted to start with this whole idea. I think some people thought everyone's going into lockdown, we're going to have a baby boom in 9 months. And that is not what you have seen. Is that right?
Yeah, that's correct. There's sort of, no offense, naive view that, when you just throw couples together, what you get is more babies. And there may be a little bit of that, but that's not the driving force behind changes in birth rates. I mean, we're much more in the category of the historical experience that says when there are disasters, the birth rate falls.
Mm-hmm. So you see maybe a little boom when people are thrown together by a snowstorm.
Right.
But this is obviously a much larger shift that we're seeing.
Right, exactly. I mean, if people are sort of planning to have a baby and you suddenly give them like a week together, like that might make it more productive. But, in modern society, modern America, we have contraception. We have a lot of people are planning. The people who are planning are probably more of them are saying, I don't think so, than are saying, yes, let's do it now. And then there's also all the unplanned pregnancies, which are probably also happening less now because people are just socializing less.
Mm-hmm. So what do the numbers tell us so far?
Well, we have about 6 states that are giving us numbers on a monthly basis that have gone through December. And most of them are in the range of a 5 to 10% decline in births at the end of 2020 versus the end of 2019. California is an exception. California just posted a number down 19%. In 2020 versus 2019, just for December. And that's really large. And so it's possible they'll revise it upward a little bit, but they have not been changing their numbers much as they go. So I'm quite, that's a big one.
Yeah.
And it's indicative of a steep decline either way.
Well, so talk to me about this sort of historically. What is the reason you think behind this potential baby bust, as people are calling it? And what does history tell us?
Well, history basically shows that during crises and emergencies, the birth rate falls. And the main reason for that is people just become more cautious, more anxious, more depressed, more isolated. They also, if their health is harmed, that also contributes. So everything is basically on the downside when there are disasters. There is a question about whether this is more like an earthquake or a hurricane or more like a war or a depression. And so will it be long lasting, or will we see something more like a quick rebound? And we can only speculate about that.
Mm-hmm. What is your speculation?
Well, we never recovered from the decline in births that happened after the Great Recession in 2009. So we've been sort of trending downward ever since. And we also saw declining births in the middle part of this year, in June, July, and August, which was a little surprising for those of us who were watching this, because that probably wasn't driven by the pandemic. So I think a lot of things are pointing towards this being part of a larger decline in birth rates and probably longer lasting.
Mm-hmm. Why are we seeing a longer term decline?
Well, in the long run, a lot of countries are seeing declining birth rates, and the reasons there are multiple reasons, but one is certainly the cost of children, the trade-offs, that is sort of the opportunity cost of things people give up to have children, the difficulty with work-family balance and managing time, and less of a sort of, I don't want to say ideological, but less of a commitment to devoting ourselves to child rearing, at least in large quantity. There's people are very, people devote a lot of time and energy and money to their small number of children, but that same energy doesn't turn into the desire to have more children.
Is this good or bad as a trend?
Well, in the long run of history, it's good that we have fewer children, especially for gender equality, for women, that women's lives are not devoted to bearing and raising children like they were in the olden days. So that's good. The difference between, 1.5, 2 and 1 child, I don't really have an opinion about whether it's good or bad for society. I think it poses challenges for us if the birth rate falls very low or remains low for a long time, sort of fiscal problems, funding social security, and, having a vibrant workforce and things like that. So there are things we have to work on. Further afield from this, the topic of today, but, in this country, we're fortunate that we can have a lot of immigrants if we really need more people.
So I know that the numbers are fairly preliminary. Do you see trends sort of that vary based on race?
We don't know yet for this year, although for the years leading up to 2020, the birth rates were falling for Hispanic women and Black women more than for white women. So sort of the birth rates were getting more similar across those groups, but we don't know what's happening in 2020.
Besides the numbers that come out, how are you sort of predicting these trends? You're using unusual methods. Yes.
Well, I and some other people have been looking at other indicators that we could find. One has been Google searches. And people Googling for pregnancy-related topics definitely declined in the middle and second half of last year, things like morning sickness, pregnancy vitamins, and things like that. But also, I also found less Google searches for sex-related topics, things that you might expect to reflect the fact that people are just having sex, like pain during sex or bleeding after sex, so things that people search for, and there are big declines in those searches. So it's hard to exactly pin those down to numbers of births later, but it's certainly suggestive. There also has been very large drop in condom sales, at least for the Trojan company last year, double-digit drops. And then the other things you can look at are just the indicators of socializing, like bars and restaurants. And of course, the movie industry went out of business, basically. And a lot of things that tell us that people are doing less of the things that lead up to sex and children.
So we're not just not having babies, we're not really having as much sex, it appears.
Yes, and I think that is, I think that's probably the case among married couples and people living together because of stress, anxiety, tension, and uncertainty. But also in the category of people who are just meeting and developing relationships.
So I guess that leads to another question. I understand you're also looking at marriage rates this year. How are they going?
Yeah, there was a pretty large drop in marriages. Sort of the spring and summer wedding season was a bust last year. And it's not clear yet how much of that was just sort of the logistics of getting married. But even if it was, that is, even if you took everybody and said, okay, you're going to get married in 2020, please reschedule, we would expect some of those to just never happen. Something falls through. So that's sort of that can only contribute on the downside. We don't know how big it will be. And then the question in the longer run, A, it's sort of the slowing down of relationships, but B, also the problems with insecurity and uncertainty about the future, which generally they weigh negatively on the tendency to get married. So everything points downward for marriage, although, again, preliminary.
Right. So these sort of same economic pressures that would keep someone from having a child might also keep them from getting married.
Yes, although it's complicated. Marriage is, people like being married. Usually they also get all kinds of support. They get social recognition. There are the benefits of marriage are still pronounced in this society. And you might think, well, in hard times, we should really pull together and get married and make a stronger family and face this together and things like that. There's probably some of that too, but just on net, that doesn't weigh as much as the things pulling people apart.
And I guess the logical next question is, what are you seeing in terms of divorces?
Divorces were down also in the places that were reporting, although I just saw a new study from Denmark that showed not a decline in divorce. That's interesting. They have very good data there. Again, that comes to logistics to some degree. Divorce is expensive and difficult. You have to spend money. You have to create a new household often. You have to arrange. There's travel and all the things that make it difficult. On the other hand, there are reasons to think maybe more people feel like getting divorced. And so one thing that we have seen, and we did see after the recession of 2009, is sort of a lag and then a rebound. So maybe people put off their divorces, but a certain number of them, and maybe more because of the stress and tension, end up getting divorced in the year or two that follows. So that's something that we sort of expect to see.
So overall, looking into your crystal ball, which I know that's exactly how you do your work, what do you see in the long term for what the COVID pandemic will mean for people?
Well, one thing to understand about the whole situation is that it's exacerbating almost every kind of inequality that we can see. So when you look at the people who lost jobs, the people who lost income, the people who've been sick, seriously sick, and died and had family members die, everything is increasing the inequality between various haves and have-nots in our society. And I think that's what I'm looking at for family trends coming up. That is, the people who have everything going for them are going to come out of this in a much more normal trajectory than the people for whom this has turned everything upside down. More. So people who lost jobs and housing and healthcare and family members, for them, I'm expecting to see that all the bad things that you might attribute to the pandemic will be more severe and last longer. So, I mean, I'm prone to catastrophic thinking, but I think this actually is a catastrophe.
Well, Philip Cohen, thank you so much for sharing these insights with us.
Oh, thank you very much for doing this topic.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Hagedor, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.